So yes, my name is Sarah Fox. I'm in the Human-Computer Interaction Institute at Carnegie Mellon University in Pittsburgh, Pennsylvania. And I'm actually incoming faculty now, so that's very exciting. And at CMU, I lead a lab called Tech Solidarity Lab. So today, I wanted to spend some time discussing radical care and how it can inform research practice during this time. And in doing that, I'll draw on critical scholarship across anthropology, legal studies, and design. So radical care is an idea put forth by anthropologists Hobart and Neese that seeks to recognize the vital but underappreciated strategies people espouse in efforts to endure precarious worlds, similar to the ones that we're living in now. So it's a recognition that things like the rolling back of civil liberties, government denial of climate change, and human rights abuses take a physical and emotional toll that the work of caring seeks to remedy. So to kind of encapsulate their arguments, radical care offers a way forward in the face of state-sanctioned violence, economic crisis, impending ecological collapse, and global pandemic. So radical care constitutes a kind of feeling with rather than feeling for others. And radical care is embodied in instances where care is employed against immediate crises and precarious futures. So I heard mention of wages for housework, but by way of example, we can look to the work of autonomous Marxist feminists associated with the Italian anti-capitalist left in the 1970s, who pushed for the recognition of domestic and reproductive labor in this wages for housework campaign. So scholar and activist Federici argued that by denying housework a wage and transforming it into kind of acts of love, capital has killed many birds with one stone. So the movement, which spread internationally, critiqued the atomization and invisibility of women's care work in the domestic sphere and made it difficult for women to collectively organize like other workers throughout capitalist systems. So by pushing for recognition within the public sphere, the individualized care performed by a spouse, a child, or kind of within the home became tied to larger collective movement. So we can find another example in the work of the Black Panther Party, who implemented key programs to fortify community strength and power by linking health, activism, and advocacy to the broader work within the movement. So their work included a free breakfast program that fed over 10,000 school children per day at its height, and free medical clinics that administered preventative health care, as well as housing and social services. So kind of acting in place of the state that was moving toward austerity, particularly in Black and Brown communities. So these efforts reverberated transnationally, giving rise to kind of a global consciousness about the important connections between physical well-being and anti-racist work. So we can also see examples of radical care in the work of street medics who care for those who've been subject to police violence. So most recently at the Black Lives Matter protests, which have kind of bubbled up across the entire United States, but are also happening across the world. So notably with the removal and disposal of a monument to slave trader Edward Colston in Bristol Harbor, for example, just a few days ago. So inherent in these examples lies a commitment to solidarity over charity or service. So charity relies on neoliberal discourses of moral obligation and individual character, while solidarity instead relies on working with communities and asking them what they need rather than kind of making assumptions. So coalitions inspire people to work together across class, race, ethnicity, religion, state boundaries, toward a common cause. So this could mean something like healthcare access, food insecurity, in the case of Black Panthers, and gender equity in the case of wages for housework. So these examples also represent kind of responses to immediate necessities. But thinking about and beyond urgent needs like the next meal or rent, the work of radical care also seeks to understand the root causes of harmful conditions and build alternative structures. So where issues of food access are settled, for example. So in imagining these alternative worlds, it becomes equally important to consider the dismantling work that might be necessary to now, in the now, to achieve those alternatives. So drawing on legal scholar Dean Spade and trans activist, this dismantling work includes kind of work to dismantle harmful systems or beat back their expansion, work to directly provide for people targeted by such systems and institutions, and work to build alternative infrastructure through which people can get their needs met. So in the time of pandemic, mutual aid is a form of kind of political participation which has emerged, in which people take responsibility for caring for one another and changing political conditions. So not just through symbolic acts or putting pressure on their representatives and governments, but by actually building new social relations that are more survivable. So mutual aid is often devalued iteration of radical care that provides transformative alternatives to the demobilizing frameworks or bold expressions of dissent that dominate our popular imagination of kind of large-scale protests or say a charismatic leader of a movement. But mutual aid projects also cultivate solidarity, and they do so by creating spaces where people come together based on some shared need or common concern. And encountering and working closely with people whose lives and experiences are different from their own. It also means kind of building up skills of collaboration, participation, and decision-making that didn't exist before. So in effect, those involved in mutual aid learn the skills and capacities to live within the world that they're trying to create. So shaping by practice of collective self-determination. So by looking at what skills work in the face of disaster, we can learn what we want to build to prepare for the next pandemic, storm, or fire. So turning to how these ideas might inform our own practice, we can look to a set of commitments to research justice that design research scholar Mariam Assad proposes. So design research pushes to acknowledge community partners as experts in their own rights, making space in the relationship to include and build on non-academic forms of knowledge, including local histories, non-Western epistemologies, or the preservation of underrepresented narratives. So Assad highlights three main opportunities for intervention within kind of research practice. So namely social relationships, resource distribution, and counter institutions. So by way of example, social relationships, reconstituting social relationships can be expressed in the form of something like a memorandum of understanding, or an MOU for short. So this is a document that is produced by a series of questions which serve as an artifact for all parties to commit to being accountable through their respective work. So this is kind of similar to work that's already done within community-based research across the social sciences. So this artifact essentially guides researchers as they acclimate to the practices and norms of their community collaborators and reflect on their progress, adjusting and iterating to their research over time and to better align with kind of the desires and needs of the community. It's a way of kind of responsibly scoping the commitments to collaboration, particularly for the researcher, by identifying needs and resources that they possess, which will inform kind of any interventions that are feasible or reasonable. And it's a need to acknowledge that the research subjects can often care deeply about the research that you're doing, and want to know about the outcomes and the ways that they're represented and recognized. Another example is in circulating resources. So finding ways to look and kind of seek out the opportunities and resources that we as researchers have access to, that can support justice work for our collaborators. So this can span kind of a spectrum of material resources. So thinking about digital devices that we might have access to, software licenses, siphoning off grant money, for example, or professional training. So how might we kind of serve as educators or designers in service to movements, as facilitators, administrators, doing data entry, for example. And then also to our networks. So how can we be intermediators or facilitators that put communities in contact with developers, legislators, politicians, and so on.
Sorry, Sarah, you need to start to wrap up. Sorry.
Sure. Yeah, I'm on the last slide. So, and then finally, the last example is in building counter institutions. So drawing attention to the larger structures and institutions of violence and oppression in which our work sits and can be complicit. So an example of this is the Atlanta jail closure. There was a jail closure in the downtown Atlanta, a city in the southern United States, which worked with a group called Designing Justice, Designing Spaces to transform the jail into a city center for wellness and freedom, where people, both ex-inmates and not, can access resources to help integrate them back into society by way of rehabilitation, job training, and other avenues, which is seriously being considered by the city government. And then finally, I'll just leave you with a set of questions sparked by this discussion. So if given the time, space, and resources, how do you see your research expanding or shifting to address kind of newly pressing needs around COVID and the world after? And what aspects of radical care might you carry forward in your work? Thanks.
Thank you very much indeed, Sarah. I really, really like the idea, the concept of radical care. It is one I've come across before, but it's great to hear you go into it in such detail. That's fantastic. So we have time for a couple of questions from people, and if nobody asks them, I certainly have 2 questions here, but I'd rather ask other people's questions. So I'm just gonna ask one of my questions and then see what happens. So yeah, in the whole thing of radical care and solidarity versus charity, I do have some concerns that if we're thinking about things like, meals provided for communities, like we have food banks, you mentioned Black Panther meals, but actually isn't an awful lot of it, including a lot of mutual aid, just mopping up the excesses and the way that we've all been trampled on by neoliberalism, and actually not doing anything that's transformational?
Yeah, I think it has to work in tandem. Like, it can't be kind of a separable thing. So I think the interesting thing about lenses of radical care is that they offer a way to think about immediate needs. So thinking about kind of literally the day-to-day kind of health care of people and those needs, as well as kind of reimagining things like the Atlanta example, the kind of jail to community center example, kind of reimagining what those the space of the public center could be. So rather than centering kind of police violence and punitive kind of measures, we can think about kind of reimagining from the immediate kind of day-to-day needs to all the way to kind of rehabilitation and transformation.
No, that's good. And well, following on from that then, and again, nobody else has typed a question yet, but I'll ask another one. The idea of dismantling, now that's quite an interesting concept, but we have a situation in the UK where actually some of the right-wing thinking happening at the moment particularly Dominic Cummings and the other people that he associates with and the kind of right, and plays a central role in our government at the moment, is very much about dismantling, but not in a positive way. How do we make sure that the dismantling that takes place is the right kind of dismantling? Because actually an awful lot is happening and in the guise of COVID-19, below the scenes, we've got privatisation of our NHS going on even further. I mean, it was happening massively before, but it's going on even further. So there's tons of dismantling happening. How do we make sure it's the right one? And what can we do about that?
Yeah, that's a good question. I think, certainly a similar thing here too in the US. Our current president just came to power on that kind of dismantling idea, draining the swamp. But actually, the work that's really happening is kind of further entrenching the kind of relationships, the connections between the state and capital. So making those ties even stronger. But I think with that, it hasn't, there's, in tandem again with that is also this kind of transformational work. I mean, we can see it now, especially kind of expressed in the streets. The city of Minneapolis, for example, is seriously considering dismantling the police as we know it. And actually in Camden, New Jersey, that's already happened years ago. Yeah. So it is possible to do these things kind of in response, but it does take large scale kind of coordination and the work of reimagining. So not just kind of tinkering with the systems that we have already, but drawing on, in the case of kind of police reform, like decades of abolitionist scholarship and activism to kind of very kind of thoughtfully and carefully kind of reform them from the bottom up.
No, that's a really good example, the defunding the police that you gave. And actually, I can see some ways that this could happen in our communities if we have universities, Citizens UK, ACORN, other community activism organisations joining together with anchor organisations and actually using research and actually trying to say, okay, what should we do, and being very, very strategic about the kinds of things we should be focusing on, but doing it from a kind of making structural change happen.
Mm-hmm, exactly. I mean, I think about the figures again. It's top of mind here, but on police violence and abolitionism, thinking about figures who are prominent within that space. I mean, it's Angela Davis, it's Ruth Wilson Gilmore, who are academics as well as.
Interesting. No, that's very interesting. Yeah. It'd be good to hear more about. Could you put the names of those people in the chat so that people can follow those up?
Yeah.
Sadly, we're going to need to finish now in terms of Sarah. I know this is bizarre, but I have to give you a clap. I can't. Sorry, everybody. I know this might look a bit weird, but ritual is ritual, and I'm going to sit and clap in your own rooms if you want to. But thank you very much indeed, Sarah. Fantastic talk, and we're delighted that you're going to be with us in our